Good evening. Today is Wednesday, August 28th, 2019. Commissioners Court is meeting for a public hearing. Item number 2, receive public comment, both proponents and opponents, on the proposed tax rate for fiscal year 2019 through 2020 for the El Paso County Hospital District.
Property tax public hearing fiscal year 2020. According to Tax Code 26.05, the county may not adopt a tax rate for the El Paso County Hospital District doing business as University Medical Center of El Paso, the hospital district that exceeds the lower of the rollback tax rate or the effective tax rate calculated as provided by the Texas Property Tax Code 26.04 until it has held 2 public hearings on the proposed tax increase. The tax rate proposed for the hospital district on August 12, 2019, and published on the same date exceeded the lower of the effective or rollback tax rates. All persons, both proponents and opponents of the tax increase, will be afforded adequate opportunity to present their views.
Can
Michael?
we please have a motion to open the public comment? I'm sorry, the public hearing.
So moved. Second.
Commissioner Perez?
Aye.
Commissioner Leon?
Aye.
Commissioner Stout?
Aye.
Commissioner Robinson is absent. Judge Samaniego?
Aye.
Motion carries.
Good afternoon, Judge. Good afternoon,
Good afternoon.
Commissioners. What we have here, I've got a brief PowerPoint presentation from the detailed one that we did with the 2 budget work sessions. Where we are right now with our 2020 budget timetable, where the arrow is, we're now at our tax rate public hearing number 2, and then on Monday, September 9th and 9:30, that's when the Commissioners Court will meet to approve the budget and the tax rate. The budget, what we're talking about for El Paso County Hospital District, it does cover University Medical Center of El Paso Health, El Paso Children's, as well as University Medical Center Foundation. Here we're illustrating the district net position change since 2017, where in 2017, the actual decrease in net position was 41.1 million. In 2018 was 31.3 million. The budget that we have for 2019, the current year that we are in, was at 11.2 million. The forecast that we have based upon June actuals and then a forecast for July, August, September shows us that we'll probably be right under $10 million decrease in that position. And then for the 2020 budget that we are presenting, with the rollback tax scenario that we are presenting, we'd be right at about $1 million decrease in that position. Talking about in terms of the 4 separate component units between 2019 and 2020, you'll see that between 2019 and 2020, there'll be an improvement to the overall net position by about 8.7 million. UMC will represent about 7.6 million. El Paso Health, a decrease of about 2.4 million, and mostly that's due because of some expansion programs that they're doing into the Medicare Advantage program. El Paso Children's, an improvement of 2.3 million, and the foundation, an improvement about 1.3 million. The overall budget for the district as a whole, we're expecting to have total revenues about 858 million, broken up there between net patient service revenue, 44%, premium revenue with El Paso Health, 23%, our Medicaid supplemental revenue, and then our property tax revenue of 119 million, representing 14% of the district's entire total revenue budget. The expense budget is about 859 million, with the 3 largest amounts being with salaries and benefits. That's about 33% of our budget, followed by medical claims, which is El Paso Health at 173 million or 20%, and then followed by supplies, pharmaceuticals, physician fees, purchase services, etc. One of the items that we do measure the maintenance and operations property tax revenue is compared to the estimated cost to provide uncompensated care at University Medical Center. In 2017, the estimated cost to provide uncompensated care was about 155 million. The maintenance and operations portion of the property tax revenue was 69 million, leaving us a deficit of about 86 million. As we're now looking to 2020, we are forecasting or budgeting that the estimated uncompensated care cost will be about 190 million, and with the maintenance and operational property tax revenue coming in about 96 million, assuming the rollback tax rate, still leaving a deficit of about 94 million. And this is the amount that we make up during the entire year by other revenue sources. When looking at the property tax scenarios, going from left to right, fiscal year 2019, our current tax rate is 0.251943, based upon the total taxable value of about $43.6 billion. That's going to generate right under $110 million in total property tax revenue. On the average home value of $131,303, that is an annual property tax bill of about $330.81. Moving to the furthest right column, with a rollback tax rate that we are proposing, it would be 0.267747, which is an overall rate increase from the current tax rate of about 5.61%. On the when you multiply that times the total taxable value of $44.7 billion, that's going to generate expected property tax revenue of $119.7 million. There's a variance from the current year, about $9.8 million, compared to where we are currently right now for 2019. The variance from the effective tax rate is about right under $6.4 million, $6,362,000. On the average home value of $133,590, the annual property tax bill would be $357.68, an overall increase from the current tax rate of about $26.87. Now, last week, one of the questions was asked, the difference between the current tax rate to the effective tax rate, which was the change in values, and then from the effective tax rate overall to what the tax rate increase. Of that $26.87, $19 of that is related to the tax rate increase, and $7.87 is related to the property value change. And that's roughly about a 73%. I think Wally had mentioned theirs is about 70, ours is about 73% tax rate request increase, 27% related to the values. And in closing, in terms of the unrestricted cash, we do forecast right now that as of September 30th, 2020, that the district's unrestricted cash and investments will grow from about $40 million at September 30th, 2019 to about $48 million in 2020. And last, on our routine capital budget, it's about $13.7 million for the district. University Medical Center right at $10 million, El Paso Health at $2,796,000, and El Paso Children's $950,000. With that, if there's any questions or comments, I will take those at this time.
Commissioners?
To close the, or actually, I guess we're going to have a public hearing.
Public hearing. Yes,
We
there's
do have
question.
one guest signed up to speak today, Mr. Kyle Montecone.
Good evening.
Good evening.
So, full disclosure, I am an employee of the El Paso County Hospital District. A little background about me: my father has been an OBGYN in our city for over 20 years. My mother is a real estate agent as well as a community ambassador for one of our local hospitals. She tours physicians to our area and finds them homes. My sister graduated as a top 10 senior from UTEP this year, and she is going to attend physician assistant school in San Antonio before coming back to our community. I was valedictorian of my high school, graduated with 2 bachelor degrees from Texas Tech, graduated with my master in healthcare administration from Texas State. I'm currently going to school for 2 more masters before getting my PhD. After working with University Health System in Lubbock, University Health System in San Antonio, and St. David's Medical Center in Austin, Texas, I decided to move back to El Paso because I want to advance our health systems. I am advocating for a tax increase for the hospital district. As an administration intern for the last 3 years, I've had the privilege of working at our brand new outpatient clinics, El Paso Children's Hospital, and University Medical Center. I have seen growth and the challenges that come with it. Currently, our East Clinic is facing capacity issues. Wait times went from minutes to hours. It's not a throughput problem, it's a resource problem. Within the next 10 years, I anticipate that we are going to have to build another clinic, possibly a micro-hospital farther east to meet the demand of care. There are several reasons why we need a tax increase. First, we need additional bed capacity at our main hospital. I'm not sure many of you know this, but on the day of the El Paso shooting, our critical care units were at capacity. We didn't have any available beds. The only reason we were able to accommodate the victims were because our employees worked together and patients already in bed sacrificed their care and volunteered to leave to free up space. My office is in our bed management command center, and I see our bed capacity every day. Second, we need to recruit and retain top talent. Out of 47 of my friends from El Paso who received an education with the intent of being part of our medical community, only 4 are still local. I too have had significant opportunities outside of El Paso, and I continue to get executive offers to leave. But I've committed myself to this community. In fact, I bought a house earlier this year. Even though I work for UMC and a lot of my taxes go back to our hospital district, I'm okay with it. I know we need the funding to retain and attract specialists and associates to care for our population. Third, many members of our community are still leaving to seek specialty care. El Paso Children's Hospital alleviated part of the problem with their pediatric population, but there is still much work for our system to do. My next-door neighbor's just-born nephew had to see a specialist in San Antonio last week for cardiology problems. He didn't make it. A couple of weeks ago, doctors found a mass in my mother's throat. She had an initial biopsy, but the physicians wanted her to get advanced testing that is not available in our county. She's coming back from Dallas in a couple of hours with the results. There's a demonstrated healthcare need here, and I could speak for it. I know it's not attractive to raise taxes. No one wants to pay more of their hard-earned money. But what the naysayers don't realize is that we're going to be the first institution they go to when they need medical attention. Disease is not always a predictive process. It does not discriminate with age. You may unfortunately find yourself in an ailing state that needs advanced care to live, and I hope we have the services available to help. Our population is aging and living longer. With the advancement of life also come challenges to living. We're going to need more gynecologists, geriatricians, cardiologists, nephrologists, rheumatologists, and even psychiatric services to provide comprehensive care to our community. Our system needs resources to support these physicians with the new methods that they are being trained with. Some of our departments have equipment that is nearing their end of life. Some techniques and practices are over 20 to 30 years outdated. Our current budget can't accommodate all of these requests for modernization. We have to choose which treatment technology we update, and other methods have to wait on the list. Our health district is here for our community, the challenges that come with it, and the task of modernizing our services for the future. Support our hospital district. Support our mission. We are here to heal, to serve, and to educate, and we are resource constrained. Please approve the tax increase and any future hospital district bonds because the future of your grandparents, parents, children, and their children's health and lives depend on it. Thank you.
Thank you, sir. Thank you.
Okay, move to close public hearing.
Second?
Commissioner Bettis,
Aye.
Commissioner Leon,
Aye.
Commissioner Stout,
Aye.
Judge Samaniego.
Aye.
Motion carries.
The Commissioners' Court will meet on Monday, September 9th, 2019 at 9:30 a.m. in the Commissioners' Court Chambers, Room 303 of the El Paso County Courthouse Building, 500 East San Antonio Street, El Paso, Texas, 79901, to adopt 2019 property tax rate for the El Paso County Hospital District doing business as University Medical Center of El Paso to be collected during its 2020 fiscal year.
And this completes today's meeting at 6:15 p.m.
Meeting adjourned.